Hello everybody, my name is Veronica Kinsler. This is the end of April 2020 and I'm here to do the fourth video of question and answers for Caring Matters Now. People have been sending in questions on CMN and I'm trying to answer them. So I've got some more questions to deal with this week. First of all, I have a question here about new treatments for melanoma in general, including vaccines for melanoma, and whether that relates or helps at all with the treatment of melanoma in CMN. So yes, all treatments that are developed for melanoma in general in the normal population we are interested in, and we are always keeping a lookout for those things. Because the numbers of melanoma cases in CMN are low, there have been no big studies of treatments in melanoma in CMN. There have only been smaller studies, but it is true that anything that is published in general melanoma we can consider using. So we're always on a lookout for that. The next question I have is someone has been wondering whether there's a connection between autoimmune conditions in parents. I think in particular they mentioned rheumatoid arthritis in a mother, and psoriasis in a mother, and the child having CMN. And no, we don't know of any connection between those things. So we don't have any data to suggest that there has been that sort of connection before. The only thing that has been published previously is that we did find what appeared to be quite a high number of parents having thyroid problems when children had CMN, and we don't know how that is connected. We also don't know if it's definitely the case because it was only one study that we did. It hasn't been done again, and what we like to see usually in science is that results are replicated. That means if one team finds something, that it's then able to be confirmed by another team. That makes it much stronger. So we're not sure, but we certainly didn't find any other types of conditions at the time when we were looking at what was running in families. So at the moment, no, we wouldn't think that that's connected on what we know at the moment. And next, there was a question about the pigment in the hair. So the hairs that are on top of a CMN, whether the pigment can disappear. And yes, that is definitely something that we see happening. So the hair can become white or grey before the rest of the hair would become white or grey. So sometimes that can even happen in childhood. You can start to get little white hairs appearing. And as people get older, that can happen more. Again, we don't know why this is, but it is almost certainly connected to the fact that the hairs in CMN are different. They behave differently. They are somehow under the influence of the mutation that is there. So they grow longer than normal hair. They're usually darker than normal hair. They're often coarser than normal hair, although not always. Sometimes they're lighter, which is rare but can happen. And yes, definitely they can become white or grey earlier than they should. That isn't something to worry about, but it's also something that we don't have a treatment for. They could be dyed, but actually most people tend to shave their hair. Obviously, if it's on your head, then it's not something that you probably want to shave, and therefore dyeing those hairs may be an appropriate way of dealing with them. There's no problem with dyeing hair, so somebody else asked a question about dyeing hair that's on CMN. There shouldn't be a problem with that, but we would suggest that it wouldn't be done with a dye that was put onto the CMN, so not onto the scalp, but something that would actually colour the hair itself. So hairdressers know the differences in those things. So that would be something to ask a professional about doing. It would certainly not be something you would want to put the dye onto the CMN itself. Then there was a question there was a couple of questions about whether surgery reduces or increases the risk of melanoma in CMN. So this is a long answer to that question. The simple answer is no, as far as we know. but the reason is complicated. So obviously, if you have one small CMN and you can cut it out, if that had a risk, you would be, in theory, removing it if it is totally removed. However, the risk of melanoma in small single CMN is very low. It's like for any mole on our body, and we don't go around cutting all those off. So actually, although it's true that will reduce the risk in that one part, it isn't something that had much of a risk. So in cases where there is a higher risk of melanoma, and we've been talking in a previous video about this, that tends to be in people who have abnormal MRI scans of the brain. And also those people tend to have lots of moles, lots of CMN on their body, and sometimes big ones. Those are frequently not possible to operate on. So trying to remove all the areas of CMN on somebody's skin where there really is a risk, where they've got a higher risk, isn't possible. And therefore, no, we don't think surgery reduces the risk there either. The question as to whether it increases risk is a very interesting one, which we never forget. It's very tempting to think of surgery decreasing, but people don't necessarily think that it might increase risk. I think where things are not completely able to be removed, we don't know the effect of surgery, and sometimes things which set up inflammation can seem to activate moles around them. So for example, in the normal population, people don't remove half a mole. If there's any queries about moles, they take the whole mole out. So that's a long-winded answer, but basically no, we don't consider that surgery really is a treatment for the risk of melanoma in CMN. I hope that makes sense. Other questions. I had somebody asking a question whether having a CMN on your legs would reduce the power in your legs. So there is not any hard evidence on this at all. It's true that sometimes when the CMN is on your legs, one leg is thinner than the other. And that can be because the fat is less well developed in that area, but actually we've also shown that it can be because the muscle is less well developed there too. That can happen. But practically speaking, it doesn't seem to matter. I do have one case in mind where I know that the person thinks it does reduce their power a bit in that leg, but in general that's not something we hear. Usually people don't report that as a problem. So I think most of the time, although the leg might look a bit thinner or the arm might look a bit thinner, it's not usually a practical problem in terms of strength or power. Someone else has asked about whether CMN can affect speech development. Definitely we know that the commonest problem with neurodevelopment that we see with children with CMN would be a delay in speech. So it is very common actually to have a delay in speech in the first few years of life with CMN, with multiple CMN, usually with more than one. And what we usually see with that is it's a problem with expressive speech. That means it's a problem for the child to express what they're saying, but they usually understand everything. So that's the commonest thing we see, and usually what happens with it is it catches up with time. So we wouldn't expect it to delay the speech a lot. We tend to say, as a rule of thumb, it could easily be delayed 6 months behind normal, but then would catch up. So if it was more than that, if it's many years delay, that we would not say is what we would see commonly. That would be unusual and should be looked at. So if it's longer than 6 months, we would definitely consider getting it checked out. Next of all, in terms of questions, I have a question here where someone has asked a very interesting question where they said if a baby is born with one CMN and then develops a small mole in the first year of life, does that count as a satellite? Does that count as a second CMN, or is that just a normal mole? And that's a very interesting question. What we know is that normal children without CMN, so anybody in the normal population, can develop 3, 4, 5 moles a year in childhood. That's absolutely normal. So we would expect children to do that. But we also know that it's possible to develop new CMN over time in the first few years in people who have a lot of them. So unless you really look at it, and it might depend a bit how big it is, that sort of thing, we usually cannot say for sure. As a result, we tend to just count the ones that are there at birth. So I would count the ones that are there at birth. If there is only one at birth, then I say it's one at birth. So that's how we tend to deal with that problem. Last of all, somebody wants me to discuss whether there's any research about using drugs for people who have neurological problems with CMN and where they have some symptoms, but they don't have melanoma, so that they might have problems with maybe seizures or development, and whether we could suggest any drugs for that. So at the moment, we don't have any published data about this. So there hasn't been enough cases of this for us to make any conclusions. But it is true that some people are trying to use drugs a little bit to potentially help in that sort of case. And there should be a few cases of that being published in the next year or two, I think. People are trying, where they are using those drugs, they need to use them for a certain number of years before they know if it's been useful or not. So I think there will be some evidence on that coming soon. From what I can tell you, from what I know already, there doesn't seem to be dramatic effects. But it's better to wait for the proper publication and then we can see. And plus, different people have been trying different things, so other people may know things that I don't. But at the moment, no particular drugs seem to be beneficial in that way particularly. But we're going to continue to try. Now, let me just look for the next question. Somebody has been asking for what's the best way to deal with a school when the child is going to start school for the first time. What I would strongly recommend is asking the patient support groups about this. So Caring Matters now has fantastic resources. So they have wonderful information leaflets for teachers, for schools, and they have them for different ages as well of children, so different levels of school. And those are really fantastic. They have a whole way of how to tell the teacher and how the teacher should deal with it in the classroom. In addition, also actually talking to people that have been through the same situation, the same scenario is very helpful. So talking to other patients from the support groups who've already done it, that can really help. There's then a question on how having CMN, does it relate in any way to having poor ovulation in females? So problems with being fertile, I suppose, is what they're asking, or problems with hormones or periods. So we know that sometimes there can be subtle hormone changes in people with CMN. We've demonstrated that before, for sure. But those problems don't seem to affect going into puberty, that's normal, and they don't seem to affect people's ability to have children. So there might be some minor hormonal changes in early childhood, but we don't seem to see those having an effect on pubertal development or on fertility. So that's good. And then, last of all, someone has asked about whether CMN can be diagnosed during pregnancy. So in one case I know of, people had found something on ultrasound scan, but they didn't know what they were looking at. I haven't seen any cases where the CMN has been diagnosed antenatally. There will no doubt be one. Somebody will hopefully write in and say. So maybe if it was something that the person doing the ultrasound scan, they knew about CMN for some reason, perhaps that's something that could be diagnosed. But ultrasound doesn't show up beautiful colour pictures. What it shows is measurements and and things are all very fuzzy. You'll know from the scans that you can get when you're pregnant. They're pretty fuzzy. So actually, I think at best, if there's something on the back or the back of the neck, sometimes they measure the back of the neck anyway. And I think sometimes it can look a bit thick if there's a CMN there. But no, I haven't seen any cases being diagnosed before birth. And at the moment, I don't think that's likely to become something that would happen regularly. So I think I've covered everything. I'm just trying to check through in case there's anything else I've missed. Oh, there is a question on whether people who have CMN or their families have CMN need to be generally screened for cancers. And no, I don't think there's any evidence to tell us that people need to be screened for cancers in general. So obviously, there are some families who are prone to cancers, but we don't have any connection at the moment between that and CMN particularly. So no, the answer to that one would be no. So at the moment, I really hope I've managed to answer everybody's questions. This is something that we could do again in the future if we had to. At the moment, I hope these 4 weeks have been helpful to you. I really miss you all. I miss seeing you all. Hopefully we'll get together again in the future and at some family days. And I really do wish you all the best with lots of love from everybody in London. Bye then. Bye bye.